In this lesson, we're going to focus on the appendicular skeleton. So by the end of this lesson, you should become familiar with the names of all the primary bones in the appendicular skeleton. So as a review, the skeleton is divided into two divisions. What are their names? The appendicular skeleton and the axial skeleton. So if you recall, this is the axial skeleton in the center of the body. And let's see how well you are with remembering the names of these bones. So let's start off. What do we call the bones of the skull? How about the jawbone? What's the name for the bones of the neck? What's the name for the bones in the chest area of the spine? How about the names of the bones in the lower back? What's the name for this structure right here? How about the tailbone? What do we call that? What's the name of the bone in the center of your chest, your breastbone? And what's the medical term that we use for the ribs? And here's a bonus. What's the medical term that we use for the cartilage? Okay, great. If you remember all those, awesome. And if not, when we're done with this lesson, you want to go back and make sure you're also reviewing those that you didn't remember as we went through. So now, in the appendicular skeleton, we have basically the arms and the legs. And so let's go and take a look first at the bones of the arms. Now we're going to start with this bone up here. And this is a bone that comes across the top of your chest and intersects with the bones of your shoulder. And that bone you might know as the collarbone because that's where your collar sits, but we call it in medical terms the clavicle. Now the second bone, and I'm going to actually kind of do it on this side because I think you can see it here just as well, is one that's actually on the back or the posterior side, and you commonly call that your shoulder blade. Okay. In medical terms, we call that the scapula. So it's that flat bone on your back that you would call your shoulder blade, the scapula. The next bone that we're going to discuss is that of the humerus. Now the humerus, I call it the not so funny bone. Humor, funny, okay, haha, trying to be funny. But the humerus is the upper arm bone. And it's the largest bone in the arms, or I should say the longest bone in the arms. And when we talk about it being called the humerus, when you bang what you call your funny bone, you're actually banging this little piece on the bottom of the humerus. So it's part of your humerus that you're pinching the nerve between there and the bones of the lower arm. And so you would often call it your elbow, and your elbow is part of your humerus. So that's why I call it the not so funny bone to help me remember its name. So now the next bones are the bones in the lower arm, and you have two of them. So you have to make sure you're looking at the body in anatomical position when you name these bones of the lower arm. The first bone of the lower arm that I'm going to point out is that of the radius. Now the radius is the outer lower arm bone. the lateral lower arm bone. And how I remember this is if you take your arm, it radiates around the body, or if you twist your arm, it radiates around the other bone. So the radius is the outermost, the more lateral arm bone of the lower arm. The more medial bone in the lower arm is called the ulna. This is the one that's located closest to the body when the body is in anatomical position. And remember, that means the thumb is pointing out. So now we're going to head down into the next section of bones in the arm. And that is the bones right here. And there are 8 of them altogether. You commonly know them as your wrist bones, but we call those carpals. So you need those to drive your car. Okay, they help you steer your car, the carpals. They are your wrist bones. Now, if you remember what the carpals are, then the next set of bones should kind of make sense to you. These are the bones of the hand. Okay, so your hand bones, and you have 5 of these bones that make up your hand, and they are called the metacarpals. They meet the carpals. So the hand bones meet the wrist bones. The metacarpals meet the carpals. And then the last set of bones in the arms are the ones that make up your fingers. And they are these tiny bones that make up each of your fingers. And they are all called the same thing. They are called phalanges. So the finger bones are known as the phalanges. So quick run down through. We have the clavicle, which is the collarbone, the scapula, which is the shoulder blade, the humerus, the upper arm bone, the radius is the lateral lower arm bone, the ulna is the medial lower arm bone, and both of these are assuming you're in anatomical position. The carpals are your wrist bones. The metacarpals meet the carpals, they are your hand bones, and your phalanges are your finger bones. Next, let's take a look at the legs. So with the leg bones, we have first the femur. The femur is the longest, strongest bone in the human body. And you would call that your thigh bone. It is your upper leg bone. Now, the next bone we have is really kind of a funny bone too. It's called the patella, and your patella is your kneecap. And you didn't have one of these when you were born. Babies are not born with a patella bone. The patella bone ossifies as they begin to crawl and walk. So a newborn baby actually doesn't have this bone. So patella is your kneecap, and it functions to help your leg from hyperextending, from turning backwards the wrong direction. Next, we have the lower leg bones. The longer, stronger of the lower leg bones is the tibia, and the tibia is the top bone. You would call this your shin bone. Tibia on top. As I said, this is what you call your shin bone. This is the one you hit on the coffee table periodically that really makes you angry. The next to the lower leg bones is the fibula. The fibula is the more posterior bone. It's in the back, and I remember it because it's on the fat part of your leg, fibula and fat. It's the thinner, kind of just supportive structure. The tibia is the one that takes all your body weight when you jump, and the fibula just kind of supports that structure. So now let's get down and take a look at these bones in the bottom of the legs. First, we have the tarsals. The tarsals are your ankle bones. You might remember this is similar to the bones that we had in the wrist, which were the carpals. So the tarsals make up the ankle bones. And there's one specific tarsal I want you to know, and that one is the calcaneus. And the calcaneus sits right here, and it's your heel bone. And the reason I know that is because it's often a bone that we have problems and issues with. So the calcaneus is your heel bone. Now, similar again to the hand bones, we have feet bones. So we have metatarsals, and they are the 5 bones that make up your foot. Metatarsals meet the tarsals. And the ones I don't have on here is because we've already said them before. They are these bones in your toes, the small bones that make up your toes. And do you know what they're called? The same thing as they are in the hands. They are the phalanges. So let's run back through these again. The femur is your thigh bone. The patella is your kneecap. The tibia is your shin bone. It's on top. The fibula is the back lower leg bone, the posterior one, on the fat side or on your calf. The tarsals are your ankle bones. Metatarsals are your foot bones. Phalanges are your toes. And calcaneus is that special metatarsal that you call the heel. So now the last section that we need to talk about in the axial skeleton are the bones that connect the legs to the axial skeleton, or your pelvis. You might call them your hip bones, but they're really a circular structure that protects all of your organs in the reproductive area in the lower part of the abdomen. It includes the ovaries, the uterus, and the bladder. So when we're looking at these bones, most people think they have basically 2, one on each side, but really it's made up a total of 6 bones, 3 individual bones on each side of the body. So the first one, and that's probably the one you are most familiar with because this is the one you set your hands on when you put your hands on your hip. This is the ilium. So the ilium is the largest of the bones. It's like it says, it's the one you sit your hands on when you put your hands on your hip. Okay. It's important to know this bone because if you get into doing any injections, you'll have to be able to locate this bone in order to give injections that'll avoid the sciatic nerve. So this one is the ilium, and again, it's the same on both sides. The second bone that is in the pelvis is the ischium, and the ischium is right here and right here in green, and these are those pointy bones that you sit on. Okay, so these are the bones when you're sitting for a long time kind of get sore. Okay, so that's called the ischium. So you sit upon your ischium. And then the last one is what you might already be familiar with called the pubic bone. We call this the pubis. And let me get my line here. So right here and right here. It's called the pubic bone. And in the center, between the two, is this joint. Now, this is, for the most part, not a movable joint, but in pregnancy, this joint kind of relaxes to allow a little bit of give in the pelvis for childbirth. And this joint is called the symphysis pubis. Symphysis means to join together, and pubis for the pubis, the pubic bones. So it joins together the pubic bones. So in your pelvis, you have 3 bones in a joint. You should remember. The ilium, which are the larger hip bones where you rest your hands on. The ischium, the bones you sit upon. The pubic bones, the ones that come right across the front. And then the symphysis pubis is that joint between the 2 pelvic bones. Okay, so practice makes permanent. Go ahead, practice reviewing the bones of the legs until you know them in your sleep.